I am pleased to welcome Dr. Gina Cuyler to the program. She is the author of a new book called Insider's Guide to Leading Your Medical Care. I have the book right here. Doctor, welcome. Great to have you in studio.
Thank you for having me.
This is an important topic for everybody,
Absolutely,
right? We all
yes.
have medical care that needs to be led, so to speak. Let's start with that insider notion, though. In your experience as a doctor, what have you learned that's informed you on this subject?
Well, I've had the privilege of practicing internal medicine for 26 years. And as a primary care physician, I've seen medicine evolve over the last 30 years, from the time I was in medical school to most recently. And over time, we've had a significant increase in the number of medications we can offer patients, the number of diagnoses we can make about patients, the number of treatment options we can offer patients. But what I have not seen is a significant increase in the amount of time that we're spending with patients that would allow us to be able to adequately discuss all of those things that are available to them. And that left patients with questions, and patients without the vocabulary to be able to even initiate conversation about what they didn't know and what they needed to know to have a better understanding.
Time is such a precious commodity, especially when you're dealing with your physician. When we talk about leading our medical care, how do we go about it?
I like to keep it simple for patients. I tell them that I want them to always be thinking about the 5 W's and the H's of healthcare. That's the who, what, why, where, when, and how of their healthcare. And it's basically questions that they can start thinking about getting the answers to when they're stuck. And those are the things I want them to master.
What will we find in this book that will give us a roadmap and give us an action step as an advocate for our own health?
Well, I like to empower people to think about, what are they there for? What are their diagnoses? Who they are, what's their history? What's their family history? What medications they're on? And who are the people that are providing their care? All white coats are not the same. And oftentimes patients see someone in a white coat and they think that that person is capable of delivering the same amount of knowledge as any other person, and that's not necessarily the case. There are differences between different providers of health care, and it's important you know what they're qualified to do so that you can get the most out of their training and their expertise.
Doctor, a final thought about the book itself. If people want to give this a read and be an advocate for their medical care, where can we find it? You
can find it on Amazon.com and BarnesandNoble.com. It's available in print and as an ebook for Kindle.
All right, good options these days for all folks. And we appreciate your time on this important topic as well. Thank you.
Thank you very much for having me.
If you missed those links, we'll be sharing them online as well. More about Insider's Guide to Leading Your Medical Care at RochesterFirst.com.